Hello, my name is Levin Chetty. I am a researcher in health sciences at the University of KwaZulu-Natal in South Africa. I am the author of the study entitled Physical Activity and Exercise for Older People Living with HIV, a Scoping Review. Aging with HIV has become the latest challenge in the HIV phenomenon as antiretroviral treatment prolongs survival. However, the majority of HIV research only includes adults up to 49 years of age. Older people living with HIV are facing various challenges that continue to influence their physical, mental, and social health. Physical activity guidelines exist for younger HIV populations, but there is insufficient recommendations for older people living with HIV, especially those who are 50 years of age and older. Our aim was to map the existing literature on the effects of exercise and physical activity prescriptions for older people living with HIV. We conducted a scoping review using the methodological framework proposed by the Joanna Briggs Institute. The population concept context framework was used to align the selection of appropriate research articles with the study's research questions. 503 records were initially identified following a search of 5 online research databases. 15 articles met the study's inclusion criteria and was included for final synthesis. An analysis of the selected studies suggests that performing aerobic exercise or a combination of constant aerobic and progressive resistance training appears to be safe and may lead to significant improvements in measurements of cardiorespiratory fitness, strength, and psychological outcomes in older people living with HIV. Further evidence in the literature noted that structured exercise programs may be an initial motivator to increase activity levels in this population. The relatively low number of published research on physical activity and its effects on older people living with HIV was evidently visible, especially in sub-Saharan Africa, which is acknowledged as the epicenter of the burden. Its effect on psychological health also yielded a low return of published research. Evidence in the field of HIV and physical activity should focus on the specific challenges faced by older people living with HIV in resource-poor developing countries. With increased life expectancy in both the developed and the developing world, it is crucial that a range of alternative rehabilitation options, including physical activity and exercise, be made available to older people living with HIV. This scoping review, whilst highlighting the significant dearth of evidence, also indicates that physical activity and exercise is a promising approach that is both an effective and safe treatment option for older people living with HIV. Thank you for reading my article and listening to this presentation.